Thank you, Chairman. We're now live on YouTube and you may start the meeting.
Okay, welcome everybody and good evening to this Adults and Community Scrutiny Committee. I would like to start by welcoming those members of the public and press who are watching this live stream of this meeting through the Council's YouTube page. Due to government guidance on social distance, this meeting is taking place remotely in accordance with current legislation which make provision for remote attendance and remote access to council meetings. The meeting is also following Peterborough City Council virtual meeting protocol. In order for the meeting to run smoothly, I ask several things from members and participants. Firstly, that you keep your video camera switched on if possible, with your microphone muted except when you're invited to speak. If you wish to speak, then raise your virtual hand, which is blue and is located at the bottom or top of the device, depending which device you're using. I and the Democratic Service team will keep an eye on the participants list to see who wishes to speak. Please be patient if you're not invited to speak as soon as you've raised your hand, as there may be other people waiting to speak before you. Democratic Service team will be monitoring participants list to see if anyone has dropped out of the meeting, and will try to contact you to provide assistance to rejoin should this happen. As with all new systems, we may run into technical problems, and for this ask your patience. Should this occur, an adjournment of the meeting will be declared while the fault is addressed, and the public broadcast will be paused. If it is not possible, the meeting will be adjourned until such time as it can be reconvened. Finally, I would remind members that all virtual meetings are recorded. Before we move to the first agenda item, I'll begin to take a roll call of Scrutiny Committee members to establish your presence. When your name is called out, please unmute your microphone and confirm that you're in attendance. Thank you. Councillor Aiken.
Present.
Councillor Bisbee. I don't think so. Okay. Councillor Ellis.
Present.
Councillor John Fox.
Present.
Councillor Harper.
Present.
Councillor Howard.
Present.
Councillor Howe.
Present.
Councillor Iqbal.
Present.
Councillor Sandra Bond. Are you? Yeah, you was muted, but we got you. Don't we? Councillor Yazin.
Present.
And apologies, Chair. I just realised I missed off Parish Councillors James Hayes and Neil Boyce, but they're also both in attendance this evening.
Okay. Councillor Bisbee has just sent his apologies. Sorry, just to add by my phone. Okay, also in attendance, Adrian Chapman, Service Director of Communities and Partnerships, who will be supporting the committee as lead officer, David Beaucamp as supporting Democratic Service Officer, and other members of Democratic Services team who will be supporting the meeting in the background in case of any technical difficulties. Thank you. We'll now move to agenda item 1. Apologies for absence. David.
Thank you, Chairman. We have apologies from Councillor Brown this evening, and Councillor Harper is in attendance as a substitute. Also, as you've just mentioned, apologies from Councillor Bisbee.
Yeah, thank you, David. Okay, agenda item 2. Any declarations or whipping declarations? I will just say that I am on the board. I'm board member of Peterborough Limited. Any others? No hands up. Okay, we'll move on. Okay, agenda item 3. We now move to agenda item 3, minutes of Adults and Community Scrutiny Committee meeting held on the 30th of September 2020, pages 3 to 10 of the agenda. We are being asked to approve the minutes as set out in the agenda as a correct record. Can I ask if any member who does not agree that the minutes are a true record of the meeting, click the raised hand function on your screen now, please. Okay, no objections as I can see. Okay, we'll take it that the minutes are agreed. Thank you. Okay, agenda item 4. We'll now move to item agenda 4, call in of any cabinet member or key office decision. David.
And no request for call in, Chair.
Okay, thank you, David. Okay, we'll move on to agenda item 5, draft affordable warmth strategy 2021 to 2025, housing renewals policy 2021 to 2024, pages 11 to 80. I'd like to welcome the following officers to present this report: Sharon Malia and Belinda Child, I believe. I don't think Debbie's attending tonight. Okay,
Good
who would like to?
evening.
Good evening.
Shall I do a short introduction to the two documents that you have this evening? So you have the Affordable Warmth Strategy, which is a new document, and a draft document, which is covering increasing energy efficiency in domestic properties, reducing fuel poverty for our residents, and improving health and well-being through increasing affordable warmth. You also have, together with that, a refreshed housing renewals policy.
Belinda, can I just hold you there?
Covers the financial assistance that we give to cover repair in properties when they achieve a category 1 hazard under the housing health and safety rating system and impact on people's health and well-being, and also the disabled facilities. Sorry.
Yeah, Belinda, do you want to turn your video off, because you're not coming across very clearly, unfortunately?
Chairman, I just switched off Belinda's video.
Okay.
Okay, am I okay to carry on? Can you hear me better?
That's better, Belinda, thank you. Yeah, carry on, thank you.
Apologies for that. I seem to have that happen to me whenever I use video on any platform. I tend to start sounding robotic, so sorry, apologies. I'll start again. Okay, so you've got 2 documents tonight. You've got the Affordable Warmth Strategy, which is a draft document which covers increasing energy efficiency in domestic properties. It covers reducing fuel poverty for our residents, and it also includes improving the health and well-being through increasing affordable warmth for our residents. In conjunction with that, you've also got a refreshed housing renewals policy, which covers housing repairs if some property has a category 1 hazard, which impacts on a resident's health and well-being in their home. It also covers disabled facility grants and the financial assistance that we give to people for adapting their homes to meet their needs and to ensure that they can stay living in their own home safely and independently for as long as possible, therefore delaying the need for a care package or going into a care setting. I haven't done a particularly long introduction. I thought it was perhaps better to spend the time answering any questions that Scrutiny Committee might have regarding the details within those 2 documents.
Okay, thank you. Before we move to questions,
is there any questions for us at the 2 documents?
Did Sharon want to add anything, or should we go to questions?
I'm happy to go straight to questions and answer those.
Okay, great. Okay, thank you. Councillor John Fox, please.
Yeah, thank you, Belinda. As you know, over the years, I've been very pleased and proud of the fact we've got a care and repair service and the handy person cases, etc., that we deal with are second to none. I do notice in the figures, though, for this year, for this 9 months, the past 9 months, the figures have gone down. I take it that's because of COVID and nothing else, because obviously they dropped last year by about 200, but this year it's a big drop to 586. So please, could you reassure me it is because of COVID and no other reason?
Good evening, Councillor Fox. Yeah, as you rightly suggest, that obviously the activity has declined during the period of COVID. Clients, rightly so, were very concerned about any unnecessary visits. They certainly delayed anything that they might consider to be essential during the lockdown that we had. However, since we've come out of the first lockdown, we are certainly now doing visits to people, and the activity has certainly increased over the last couple of months, as people are getting more confident about the fact that we're able to visit with full PPE, and they're more confident about letting contractors into their homes.
Yeah, so the backlog you'll get for next year, hopefully we'll see a vast increase if we're out of lockdown by then, hopefully. And yeah, that's fantastic. I figured that's what it was, but just want to make sure there's nothing financial or anything like that. So that's the main thing.
Councillor Howe.
Thank you, Chair, and thank you, Sharon and Belinda, for introducing the strategy. I enjoyed reading the documents very much. My questions, I've got two, which are both from the Affordable Warmth strategy. First one is at 1.3, which mentions in that list people with mental health conditions, and I was just interested to know, how are we identifying people with mental health conditions who may also have fuel poverty, because the others in the list are kind of easier to identify, if you see what I mean, but it's harder. It's such a broad spectrum, mental health. And the second question is what's happening in lockdown. As a ward councillor, we're used to going into people's homes, and we can identify perhaps if a home is cold, there might be an issue there. Obviously, we're not getting out and about as much in lockdown, and I wondered how you were reaching new people who might have moved into fuel poverty during the lockdown. Thank you.
Okay, so I can pick that up. Hopefully you can hear me. First of all, the criteria for the LEAP service, which is the Local Energy Advice Partnership, which is our main fuel poverty outreach programme. The criteria for that is very, very wide. As you can see, it's on income, but it's also on vulnerability. And we don't go into an awful lot of depth about the mental health status of somebody, but obviously just from conversations and that contact, we can identify people who you know, aren't necessarily they're isolated, and they can benefit from the assistance. So a lot of the criteria is self-assessed, rather than us doing any kind of formal assessment, because that's not what this project's about. It's about reaching as many people as possible. So the criteria for the programme is very, very wide. As far as lockdown is concerned, the LEAP service did for a period of time move to a telephone service, but there are still visits available if people want to have the visits. As officers are still going into properties, we are still inspecting properties. We're treating every person as COVID positive, so we wear full PPE. But our visits really, apart from the actual lockdown period, stopped for a period of time. But you know, we are visiting people in their homes as part of our normal day-to-day process, with all the necessary social distancing and PPE in place.
Okay, thanks very much, Sharon.
Could I just add in that also with all the calls that come in to our adult early help team, as part of the conversations with those people, whether they're existing or new, then the conversation about their home environment is also had. So we are picking up new clients through those conversations as well. And we have also been in liaison and working with the community hub to make sure that conversations that they're having are identifying people that also need the LEAP service as well. So we're trying to be as joined up and as holistic in our conversations with each contact can be, so that although we're not able necessarily to visit as many people as we might have been originally, we're certainly included in our conversation to gauge whether or not they need that help. So we are trying to be as holistic as we can, but it is slightly difficult in lockdown circumstances, but we are reaching the people that we do need to be, and ever increasingly promoting LEAP as the route in for the fuel poverty work as well. I hope that's helpful information.
That's really reassuring. Thanks, Belinda.
Councillor Yazin, please.
Thank you, Chair. My question is around the disability facility grants. The report says that the grant is subject to funding availability. So I had two really quick questions. So the first question is there sufficient funding available? And the discretionary funding that will be granted, will that be allocated on a case-by-case basis?
Okay, so the mandatory disabled facility grants are it's a duty on the local authority to provide those once a need has been identified by an occupational therapist. So there is an actually named sum of money, the DFG allocation within the Better Care Fund that comes into council, and that is solely for the provision of mandatory disabled facility grants. Discretionary grants that were given, there's two types. There's the one to top up a mandatory grant, because the mandatory grant has a maximum of £30,000, and if we're looking at large-scale ground floor adaptations, then obviously we're into the realms of not having sufficient funds under the mandatory grant award. So there's a top-up of £20,000, up to £20,000, in order to allow those larger scale jobs to take place. The other discretionary grant is to assist adult social care in its priorities and health priorities in trying to get people out of hospital where the condition of their home prevents that discharge. So we could be picking up anything about heating or the actual condition of the property, or if there has been sex neglect, we can do deep cleans of properties and get them back on track. And it's also got a preventive element as well, where we can look to prevent somebody going into hospital by doing things in people's properties, such as preventing falls, or again, you know, the risk that hoarding might present with falling objects and falls within a hoarded home. So that's the sort of work we do. They are discretionary grants. They're coming out of the council's capital programme for renewals. But you know, we've had a healthy budget for years, and hopefully that will continue. The amount that we award is not an automatic amount. A suitable adaptation is looked at, and the grant award is to provide that adaptation. So it's not like you know, we go up to the maximum amount. We look at what's reasonable and practical within that property, what will meet the need. A lot of the grants a lot of the works that we do are in excess of even the top-up and mandatory grants, so then we have to negotiate, try and find charitable funding and other external sources of funding in order to make those grants stack up with private funding as well in order to achieve those large-scale adaptations.
Thank you.
Okay, thank you for that. You answered my question, I think, in that as well. Just say, have you got sufficient funding? It sounds like you have got good funding. Councillor Howard, please.
Thank you, Chair. My question was about Appendix 1, 3.4, and I was just interested to know how we get the figures on the number of households in fuel poverty, and however we get the number that we've got in the report, is it robust enough to make sure that no one's missed? Thank you.
There's several sources of information. Every year the government commission an English house condition survey, and the levels of fuel poverty are included in that survey. So it is a sample of housing stock in across the country, but that makes up the fuel poverty figures on a regional basis, and some of those have been quoted in the report. The council itself did an exercise a few years ago where we commissioned the building research establishment to do some stock modelling. So based on it, they use a lot of Experian data as well as property attributes data in order to build a picture of where we think fuel poverty is based on deprivation and also property types. It's never going to be exact science, obviously, but we are quite good now after doing this for several years and identifying the areas where we think the fuel poverty is most prevalent, and that's, you know, in the lower income wards, in the city where there's a predominantly solid wall properties that can't be effectively insulated, and residents on our park home sites are also they're on low fixed incomes, and obviously if their park home isn't sufficiently insulated, they could be spending a lot of money on their fuel bills, especially if they're not on the gas network and on Calagas. So it's from various places where we get our stats, from national stats from the government, from local stock modelling that we've done, and also, you know, local knowledge of the city, its property attributes and areas of deprivation.
Thank you very much. Thank you.
Councillor Bond, please.
Yes, good evening, Sharon and Belinda, and thank you very much for this report. What it is, I've got two questions here. It's on page 20 from the recommendations on excess winter deaths and the health risks associated with cold homes. And what it is, it's number 9 and a question from 11. You're saying there that you're going to be training housing professionals and faith and voluntary sector workers to help people whose homes may be too cold for their health and well-being. Well, my question with that one is, how will the faith and voluntary sector workers be identified? So that's my first question. My second question is 11, raise awareness among practitioners and the public about how to keep warm at home. And what it is, it's background information really, and I'd just like to know how will you be raising awareness among practitioners and the public about how to keep warm at home? They're my two questions. Thank you.
Okay, a few years ago, the NICE, and it's the National Institute of Clinical Excellence, produced some guidelines to local authorities about how to address excess winter deaths. And the Affordable Warmth Strategy has been sort of built against those recommendations. And one of the recommendations, as you say, was about training people who go into people's houses as a matter of course of their normal business to spot the signs of fuel poverty, to have those sort of conversations. And we've been successful in training lots of different teams, occupational therapists within adult social care, and obviously the care and repair caseworkers, and I attend various health meetings as well, where I'm preaching the word about identifying potential people living in fuel poverty, but just through normal conversations about struggling with heating bills, or noticing that heating isn't on, or there are properties without adequate insulation and heating measures. So it's all about making every contact count, and when professionals are going into properties, looking wider than just for the reason that they're going in, and certainly we've been working, now we've moved into adult social care, we've certainly been working with our colleagues, social work colleagues, about the risks of living in cold homes. The LEAP service is our main service, and again, lots of teams have been trained on what the LEAP service, the LEAP offer is, and we've trained adult early help in order to make those include the LEAP offer in any contact, like Belinda said earlier, that comes into the council. So we're trying to really spread the word and get into as many professionals as we can. We've been recently working very closely with the social prescribers and the care networks coming out of the GP surgeries in order to raise awareness of fuel poverty and the risks of living in a cold home. So a lot of work has been done with those integrated neighbourhoods. I attend a health multidisciplinary team meeting where GPs refer in some of their most vulnerable clients for a multidisciplinary approach to solving their problems. And I think having a housing person on those multidisciplinary teams has been proven to be very, very valuable, because a lot of like district nurses and health professionals don't know where to go with those housing problems. And I've been able to unlock various problems that the most vulnerable clients have been facing. So, we're trying to spread the word about fuel poverty everywhere we go, and certainly I think knowledge about it and what services are available to help alleviate it, it's becoming more and more widespread.
Could I just also add in there as well that we have also been liaising and working with our Think Communities place-based lead and also the community hub to make sure that obviously one of the priorities, the Think Communities, Adrian, I haven't got the right word for it. Is it the strategy or the policy or the plan is around fuel poverty? So we're linking in with Nicola and Emma, and had some good conversations also with Steve about how we link in with those community organisations. how we get that message out, because I think that there are at least some that know about the services that we have to offer, but clearly there are also some others that don't know about it. So we're trying to make sure we're very much linked in with Matt's work in Think Communities as well. And I'm sorry, Adrian, I didn't quite know what the document was called.
Okay, Councillor Ellis, please.
Thank you, Chair, and thank you, Belinda and Sharon, for the very full report. I just want to ask a question, page 27, item 4.3, regarding the services LEAP offer and the other services like the emergency central heating offer, home energy, appliance replacement, and the Warm Homes Fund. I'm just thinking about those people who may not be aware of these things, who aren't engaged with haven't flagged up problems already, but may just have, the odd problem, with fuel poverty because of a boiler going or smaller things. That some of these things in the fund can really help. What is there? I want to know what advertising of these services is there out to the general public, so that they can, there is this available, and this is how I can perhaps access it for those who are not already perhaps been identified.
Yes, we try, and there are a lot of different funding streams that are available, but they're all under that LEAP umbrella. And we've tried to make this as simple as possible for people. So if they ring in to LEAP, and they can self-refer by just going on to apply for LEAP, then they will be screened for all of those services. So depending on what the conversation, where it goes, if they're in an emergency boiler situation, we can help with that. If they're struggling with bills, there's the income max service that can look at fuel debt and fuel bill management. Going through the LEAP service, they will get to home assessment. It could be telephone at the moment, but there is opportunity to have an actual home assessment. And they will look at tariffs. They will look at whether you're on the best supply. They will also, if they find people with in properties where they have got very expensive electric panel heaters, for example, because there isn't a gas connection, we can actually get a free gas connection to the gas network, and then provide first-time central heating. And that's on the Warm Homes Fund. So all the services that are offered are under that LEAP umbrella. So we promote LEAP, we don't necessarily promote the individual elements of LEAP, because once they get into the system, they're automatically screened for all those services and how we can help them. So to keep the message as simple as possible, we promote LEAP, and that's on the website. LEAP will also be delivering the new funding that's available that the government announced, which is the Green Homes Grant. Anybody can apply for partial funding for energy efficiency measures as a self-referral, and that's on our website as well. But also, as part of the consortium of local authorities that we work with, we won £3 million in the first round in order to deliver the Green Homes Grant, which is the new initiative. And we're looking at bidding for around 2 of that funding very shortly as well. So to keep the message as simple as possible, everything comes under that LEAP banner. That's the one that we push. And we, one of the ways that we promote it is with public health, when they're doing their Stay Well, Stay Warm campaign. So all information about LEAP will go out into the Stay Well packs that go out to thousands of people in the city as part of the Public Health Stay Warm campaign. We've got lots of partners across the city, including Age UK and Citizens Advice, that also have our leaflets about LEAP. So we've got a big network of local partners who are all promoting LEAP as much as possible.
Can I just come back? So on the promotion of the services of LEAP, do we directly advertise it ourselves, not just on the website, for example, in the media, etc., or social media, city council?
Facebook, yes, we do Facebook campaigns. We've just done one because the LEAP scheme has just started up again. So a major Facebook campaign goes out for that. But, we promote at events, and we work with Green Energy Switch, which is a part of PECT, the Peterborough Environment City Trust. They actually carry out the home energy visits for us, and they also promote it with a huge range of local partnership networks that they have. But we'll always look to find other ways to promote it, but it's the LEAP service that we promote, like I say, rather than the individual elements that fall with underneath. Yeah.
Okay, thanks.
Okay, thank you. Councillor Harper, please.
Thank you, Chair. Through you. I'm referring to page 31, and it's item 4.5. You've kindly give quite a bit of information there regarding the minimum energy efficiency standards, but there's a table in there that actually shows that you've communicated with landlords in selective licensing areas, and of 250 of them, and 54 have improved their properties to E or above. And then you've also put a column in there that those outside selective licensing, similar number, 240 rather than 250 got the letters, and only 25 went up. Now, would there be a reason? I mean, it doesn't seem a very big group to go by, to be fair, but would that, what's happening with that data? Are you looking into why only effectively half as many improved, or because surely there's a lot of different reasons that some couldn't, some, there would be reasons why they couldn't, or is it the fact that perhaps selective licensing needs widening in the area, because that seems to be what's making people improve the houses? Thank you, Chair.
Yeah, so the work that we're doing on the minimum energy efficiency standards is obviously with the PES housing enforcement team. That data is all private rented. That's properties where an EPC has done and private rented has actually been marked. So there's a lot of EPC certificates that have got a 10-year on. So we've only just started looking at the ones where we're confident that they are private rented sector, where they have a EPC rating of F and G, which obviously they shouldn't be renting out, or they should be making improvements in order to continue to rent out. And we're in a phase now where we've got grant funding available to assist landlords. So this is the carrot stage, if you like, before potential enforcement comes in April and May of next year. So giving the opportunity for landlords to get partially funded measures. We directly targeted all of the landlords within the selective licensing area that we knew had an F&G rated property, and that's the response that we've got back to date. And obviously now we're going to target them with the details of the Green Homes grant, hopefully get some uptake. Yes, probably it is true that if selective licensing was extended, then we might get better response to it, because certainly from what I'm hearing from the housing enforcement manager, selective licensing has brought in a lot of compliance with regulations and the requirements that are needed. So that's a real positive. Yeah. Is there anything you want to add to that, Belinda?
Only to say that obviously the figures that you've got there are around those landlords that have come forward. They've been offered something, and it's obviously then down for them to decide whether they want to take that up or not. And obviously that those kind of numbers may change when, as Sharon said, you know, the situation changes and there's an enforcement route that then follows up, which will be from next year. So it's the starting point rather than the finishing point in terms of the work that we're doing with regard to the housing enforcement and private rented sector.
Okay, thank you, Chair.
Okay, thank you. Yeah, work in progress. By the sense, enforcement is very important, I believe. Okay, I'm going to ask one last question from Neil Boyce, please.
Thank you, Chair. Belinda and Sharon, when it goes back to Councillor Ellis's question on publicity, have you considered using the voluntary sector's COVID-19 support hub, the hub, but also the voluntary sector ones who actually go to the residents' houses delivering support to actually promote the LEAP scheme, because they're face to face with them?
Hi, yes, Councillor Boyce. Yeah, that's what I was alluding to in my sort of add-on to Sharon's bit a couple of questions ago, that we're working with the Think Communities place-based leads. We've had meetings with the Community Hub team themselves who are doing that face-to-face contact with residents. So yes, we have made all those links. We have had discussions with them about how to include those sorts of conversation or those questions in their conversations about the house, the affordable warmth. You know, are they choosing to put buy food or put money in the meter for their utilities, etc. So and again, that's not a kind of a stop-start position. That's a developing our conversations, developing our working practices, our working arrangements together. And as Sharon said, it's making sure that every contact counts. So we've definitely made all those links. We've definitely started all those processes. I don't think we will ever be in a position where I could hand on heart say to you, we've covered it all, we've done it all, we've used every avenue. You know, I don't think there'll be a position like that. But we've certainly made all the connections with the Think Communities team and also our adult early health team. So both from our partners and our colleagues, but also the people that are actually in our own department, that we have tried very hard to make sure that anybody who has any conversation with anybody in the city is making sure that they weave in LEAP in some way or fashion. Even if that's not what somebody rings in for, then we've tried very hard to make sure that the conversation won't end without that having been part of the conversation, no matter what somebody rings in for. But like I say, it's a working together. We're at the, you know, we're probably to the start, not the start, but you know, we're not at the end of the processes. We're getting better at it all the time, and obviously making those connections. And obviously COVID has presented some opportunities to us as well. And I think that, you know, people's homes, it was obviously very important to them before, but I think during COVID, people's home environment has become even more highlighted. So actually those conversations about, you know, are you cold? Is it comfortable? Do you feel safe? Are become even more focused for people. So we're pushing an open door. We haven't got any closed doors in terms of trying to promote that at all. And we're all trying together. So I'm very grateful to our colleagues' support in that, and very positive conversations with our colleagues in the place-based Think Communities and Community Hub as well.
Okay, thank you. Thank you for the comprehensive answers there, and keep up the good work. Yeah. Okay, I would like to note the recommendations in the report, which are for the committee to scrutinise the draft affordable warmth strategy, refreshing house renewals policy, which include the schemes, initiatives, the assistance, the council will pursue in order to tackle fuel poverty and to ensure that vulnerable, low-income residents can afford to heat their homes. The proposal assistance that will be available to vulnerable households whose housing conditions are such that they may be detrimental to their health, safety, well-being, or their ability to access their home due to disability. Provide challenge where necessary and suggest ideas and initiatives to support further activity. Endorse the Affordable Warmth Strategy 21-25 and Housing Renewals Policy 21 to 2024 for the approval of the Executive. Are the committee satisfied we have done this? Please indicate by your virtual hand if you object. Councillor Neil Boyce, is that hand, have you not removed your hand, or do you want to say something? Okay, thank you. Okay, right, thank you, Sharon. Thank you, Belinda. Much appreciated. Keep up the good work. You may leave the meeting if you would like to. Thank you.
Thank you very much, Chair. We will be leaving. Thank you.
Thank you. Thanks. Okay, thank you. We'll now move on to agenda item 6, homeless review, pages 81 to 108. I'd like to welcome the following officers who are in attendance to assist with this presentation of the report. We've got Sarah Abel-Waite and Sean Evans, I believe. I believe Mo's not in attendance. Obviously, Councillor Allen is also in attendance as well. Thank you. Who would like to start on the report?
Thank you, Chair. I'm happy to open up on that. And I just congratulate Sean Evans on his wonderful new haircut. Very smart. Is that the lockdown special?
Thank you very much, Councillor. That's not getting to the barbers before lockdown 2.
Okay, I just want to say, members, good evening, members, should I say? I was rude there. Good evening, members. I do want to congratulate Sarah Abel-Waite, who I believe put together tonight's homeless review. It's very comprehensive and really hits the spot on every element that we are addressing. And I do want to draw your attention in my short sort of preview to the strategic objectives that we have. And I think item 1 on page 107 really sums up the ethos. We have a relentless focus on preventing homelessness happening in the first place and preventing a problem becoming a crisis. That's what our officers are doing so well. And I'd now like to hand over to Sarah for your questions, if I may.
Did you want to say anything, Sarah, or do you want to go straight to questions?
Okay, I'm happy to go straight to questions, or I can briefly give a brief outline. I think the report's quite self-explanatory, so if we're happy to go to questions, that would be great.
Okay, thank you. Councillor John Fox then, please. Thank you.
Yeah, thank you, Chair. And again, I'd like to echo sentiments that the work the Garden House is doing and everyone else in the Housing Authority are doing is fantastic, especially during these really terrible times. One of my concerns, as you know, and I'm aiming at you as well, James, because you're listening, is the fact that do we still keep a record of the veterans that are homeless, and is that recorded, and do you liaise on a regular basis, which I know the answer is hopefully going to be yes, with Tom Kelly to keep him informed, because it's obviously important to me and everyone else. We don't want veterans sleeping rough. We don't want anybody sleeping rough. We definitely don't want veterans sleeping rough as well. So could you update me on it? And I'll say it again, and I'll keep saying it forever and ever and ever. Well done for all the fantastic work you lot are doing. It's absolutely brilliant.
So, John, the answer is yes, we do. And I'm regularly in contact with Tom. It was a great shame that we couldn't keep Vic in the area. But Tom's been a very able replacement. And before Vicky went off to pastures new, we certainly fed into some documents she was doing, the number of veterans we're supporting. And the way we record at the Garden House on entry, identifying a veteran is very much at the top of that list. And I have ongoing discussions with the Royal British Legion and a variety of other service charities.
Yeah, I thought that was the answer I was going to get, James, and that's reassuring yet again. And thank you very much for all the good work you do, all of you.
Thank you, John.
Councillor Howard.
Thank you, Chair. Yeah, just looking at the report, and it's a fantastic report, so thank you very much. Just looking at the stats, out of 123 rough sleepers, we've managed to get 75 moved into longer term accommodation, which is absolutely brilliant. It's such a good start. I just wondered, out of those 75 that have moved into longer term accommodation, are they still in the accommodation? Because I know sometimes the transition can be difficult for people. So are those 75, how are they doing? Are they still doing okay? And are they still in the accommodation? Thank you very much.
Okay, thank you for your question, Councillor Howard. Yes, there has been some amazing work by the officers with regard to getting people from the streets into the accommodation. And one thing COVID did for us is it provided some opportunities for us to be able to get those people who previously had refused to come in. Okay, one of the other things we did is we looked at the ways that we could support people to maintain their accommodation, and we repurposed some money to provide some floating support for those people, as you've just recognised, in their transition into permanent accommodation. Okay, so a referral was done to the floating support service, a newly developed service that was expanded during our response to COVID, to ensure that people were able to have that support to go into their accommodation. They went into a variety of settings. They went into supported accommodation, some of them went into the private rented sector, and some of them went into social housing. I'm pleased to say the vast majority of them still remain in accommodation. There are a handful of people who unfortunately have failed. Some of those people have come back round to us, and we're making further offers to them because they've struggled because of their mental health, because of substance misuse, because they didn't feel able to access the support at that time. But yes, the vast majority of them still are in accommodation, and we as a service are very proud of our officers for doing that. So thank you.
That's brilliant. Thank you ever so much.
Councillor Yazin, please.
Thank you, Chair. And firstly, I'd like to thank Sarah and the entire team for all of their hard work. You've done a fantastic job, so thank you very much. My question follows on from Councillor Howard's question. I see from the report that over 75 rough sleepers have been accommodated. So the remaining 48, are there any plans to accommodate them too? What is the progress on that? And will they be accommodated too?
Okay, we're continuing to work with our partners to try and support those people to leave the streets. We currently go out on outreach 3 times a week. Okay, we are seeing some increased flow into the streets. Last week we had an increased flow into the street, and we worked with the Garden House to do an absolutely amazing piece of work and get 9 people in on one afternoon, and we were most grateful to our officers and to the Garden House for doing that. As we're aware at the moment, when we talk about the 43, we're talking about the number of contacts we have with people. We don't actually have 43 people sleeping rough. We're aware today that there are, I believe, 15 people sleeping rough. Sarah Skase, please correct me if I've got this number wrong. There are 15 people sleeping rough today, and when we go out on outreach, all of those will have an offer. If they've had an offer before and they're in a group that unfortunately has failed, we will then be talking about the stepping stones to get them back in.
If I can come in now, please, Chair. I think that's a good clarification, Sarah, because it's worth noting that the week before last, we were down to 5 people sleeping rough. There was a little sort of bubble that came up whereby we had a lot on the streets, but they were addressed quite well. So we're down to 15, which was 24, 9 we placed quite quickly. So the team are on it, and we must keep being vigilant with who is out there and engaging with them.
Thank you, Councillor Allen.
Yeah,
Sorry,
sure.
Sorry, apologies, I've got older software. I think I can't put a blue hand up. So just to add, Councillor, your thing. So those that are accommodated in our temporary rest centre at the moment, we're continuing to support those and hope to move those into some more settled accommodation in the near future. As Sarah mentioned, we've become the house of second chances, and nobody that ends up back out on the street is closed off to the service. We'll continue to support them and do what we can to get them back into accommodation, get their health and welfare needs met as well. In terms of longevity, obviously we've seen how services have come together to support rough sleepers during this time. We're continuing to harness that, and we've been able to secure some additional funding from the Ministry of Housing, Communities and Local Government, which will allow us to continue that provision beyond this financial year. And we're looking at setting up a purpose-built assessment setting where we're able to provide accommodation for rough sleepers forevermore.
That's fantastic. Thank you very much. And once again, thank you for all your hard work.
Yeah, thank you. Them 15, is that citywide? That's citywide. We're not just talking city centre, are we? We're talking citywide, yeah?
That's correct.
Thank you. Okay, Councillor Howell, please.
Thank you, Chair, and I just want to add my thanks, particularly to the Housing Needs team for the work during the lockdown and helping so many people who are street homeless into accommodation. It was great to work so closely with you, particularly Sean and Mo, during that time, and also to continue to work with you moving forward. And I feel, as a ward councillor, a much stronger understanding of the needs of our street homeless people, which is a great thing, and it's thanks to you. So thank you very much. I have a question. It's in the paper. It's 4.3.23, which is about safer off the streets. I just wondered, I understand that St Peter's Arcade is to be, there's been a proposal to permanently close that. And as we know, that area in the city centre has those most visible issues around street homelessness, and also that the Peterborough Civic Society had been making suggestions about the Guildhall and preventing people from gathering there and drinking during the day. And I just wondered where we were with that, please, with both St Peter's Arcade, and if the Guildhall is to be shut off in that way, is that going to push those people somewhere else? What's happening with that, please?
Unfortunately, I may not be able to provide an update in relation to St Peter's Arcade. I don't know if Adrian is able to provide an update on that. But in reference to displacement, obviously that's something that that we would be very concerned about if we weren't in the position that we are in now. Our outreach team are going out so regularly that we are truly confident that we've captured everybody in the city. Safer Off the Streets partnership is stronger than ever, and really the way that those organisations have come together in order to support rough sleepers during this time in the rest centres. And we're not just talking the Garden House, who have been absolutely amazing during this time. We've had providers providing food to all of our rough sleepers. We've got providers who never worked with us in the past have now come forward to work with us and make sure that we've got a truly holistic offer. So I'm confident at the moment that we're not going to displace people because people aren't going to be out there if we can encourage them to come in. And if we're visiting them regularly, then it's not a great concern that they're going to be gathering in different areas. We will find them.
Great, thank you, Sean.
Councillor Iqbal, please.
Thank you, and through you, Chair. Firstly, I'd like to thank Sharon and Sean for their report and the wonderful work they're doing. Keep up the good work. Now, I would like to ask a question which is in section 4.1 and is on page 83, if I'm right. At the bottom of the paragraph, it says, during 2020 alone, our monthly rough sleeper counts have seen a reduction from 29 in January to only 5 in October. So my question is, how can you claim that there were only 5 rough sleepers counted in October? How did you do that?
Okay, in terms of the number of people sleeping rough, as Sean's just explained, we're out on a regular basis. So we're out really every other day, yeah, in terms of outreaching and in terms of hotspots. The way we managed to get our numbers down to 5 is by making sure that everybody who we came across had an offer. And those people who we didn't come across were able to go to the Garden House, where we were able to link up with them, and they were able to be housed in that way. So that's the great work that officers have done in terms of intelligence, in terms of regularly outreaching, and in terms of of the growth that we've had in partnership work since the start of COVID.
Just to add to that, Councillor, the outreach that we're doing is generally at like 4, 5, 6 o'clock in the morning. So we're finding those people that are truly sleeping out.
Okay, so Adrian, did you want to come in? Sorry, it was probably in the last question. Sorry.
No problem. Thank you, Chair. Yeah, just to conclude a response to Councillor Howell's question about the St Peter's Arcade status. So I think it was in Growth Scrutiny Committee that Councillor Sereste mentioned that work was being considered, or work was underway to consider the permanent closure of St Peter's Arcade. That is very much the situation, but I think really key that we do that in very close association with our housing colleagues, and as Sean has rightly said, we can feel fairly confident, I think, that any displacement will be rapidly identified. And I think it's important that we set any proposals that come forward around St Peter's Arcade's closure against the broader benefits that it might bring alongside those disbenefits. And what I would say, and you'd expect this, I know, is that this will be a matter of very public scrutiny and a very transparent process. So all appropriate proposals coming forward to the right forum at the right time before any decision is made. And there'll be some fairly extensive consultation as well, particularly with visitors to the city, groups that certainly use or did use prior to lockdown that arcade, disabled people, for example, who park at the back of the town hall, and also businesses along Bridge Street, who I think at the moment are seeing some benefit to a slight diversion in footfall, but we need to make sure that that is protected. I hope that's reassuring, and happy to provide and keep members updated as we go along.
Thank you for that, Adrian. Councillor Bond, please.
Yes, I'd just like to say thank you to the Garden House and the housing team. It's been a really, really hard and tough time for us all, and you've worked extremely hard, and you've just continued that professionalism that you have. I'd just like to say thank you on that. I do have one question. It's on page 84, and it's the housing needs team, and it's bullet point 4. And the question is, just got to find it. You've done it. You've introduced a new customer-focused IT system to manage the application and allocations of social housing. My question is really, there will be customers who are not able to access the new customer IT system. So my question is, what support will there be in place for those customers? Thank you.
Okay, in terms of the system that we've introduced, it's actually to manage the allocation of social housing, and what we've done is we've made sure that those who are unable to access can get support either via the housing needs team if they don't have any support elsewhere, or via other support networks. For example, if they had a social worker or if they had an adult social care worker, they're able to do that on their behalf. Okay, there's also a really simple app which can be downloaded onto their phone by a professional, which enables them to receive alerts when properties become available, so that they have to click 3 buttons and then they're able to place a bid. So we've done our best to ensure that everybody can, and we hope we can, but those who can't, we're always there to support through a member of the housing needs team.
Okay, thank you very much.
Councillor Ellis, please.
Yeah.
Thank you, Chair. Thank you for the report. There has been a lot of work done, especially for homelessness and rough sleepers. Well done, everybody who's contributed to that. My question, I want to focus on the housing register and those people who are maybe not, maybe homeless in a sense that sofa surfing, that they're stopping around friends until they can find somewhere, or those who are living in properties, which are inadequate, too few rooms, etc. And it's around the rents, because obviously there is an issue with a lot of private rents being very high and the affordability being hard. And I could see in a report about looking at building more new affordable housing. Can the housing register is high? What actions and what plans are there for to reduce that, especially in relation to building new homes to rent, and whether it be affordable or social housing to rent? And a quick little question I see about what is the reason that Cross Keys homes don't take part in the choice-based letting scheme? I won't talk too much about allocation schemes because that's the next item, but if you could just answer those questions for me, that'd be great.
Okay, so in terms of Cross Keys not taking part in the choice-based lettings, they chose to leave the partnership. None of our housing associations, it's not compulsory that they are part of the partnership, but we still continue to let their properties through in the same way as we do choice-based lettings through the jigsaw system. So in terms of that, there's not a considerable amount of change. In terms of a shortage of accommodation, we're acutely aware that there is a shortage of social housing, and we work very closely with our colleagues, with Ankeo, to ensure that we're able to maximise opportunities in terms of new builds and in terms of accessing accommodation. And we have recently as well been successful in starting up our own housing revenue account as well.
Okay, thank you for that. Councillor Iqbal, did you have a further question?
I do, Chair. Thank you. And through you, my next question is on section 4.312, reasons for rough sleeping. And as it states there, the reason for rough sleeping are multifaceted and include poor mental health, relationship breakdown, loss of employment or temporary contracts, and substance misuse. My question is, how does PCC provide support in this area in particular? Are people housed first, or are they made to engage with services in order to be housed? Thank you.
Anybody like to answer?
Sorry, I think Sarah was talking, but she's still on mute.
Oh, bless her.
Sarah, do you want to pick up that?
Hi there. Thank you for your question, Councillor. In terms of two ways of dealing with people who have a lot of complex needs, so the multifaceted need that we're mentioning in the document there, what we tend to do is what's called a housing first approach, which means that we take the person, we provide them with accommodation, and then we wrap the services around them. There's no need for them to engage, such as you mentioned. What we do is we provide an opportunity for them to start engaging once they have shelter. Okay, so that's, I hope that answers the first part of your question. With regard to the support services that we have, as Sean's mentioned already, we've done some really great work during this period in terms of developing a holistic service with our partners, and we actually have support through mental health services. We have support through a GP as well that's available to that really complex cohort. We have floating support, and we have specialist services while they were in the shelter as well, with regard to prescribing for those who were really in urgent need.
Thank you for that. John Fox, please.
Thank you, Chair. It's a very quick one for Adrian. If I could, you brought up St Peter's Arcade. As you know, the Disability Forum at the time, and we pushed very hard to get disabled bays, and thanks to Marcos Resti and his common sense attitude, we got the disabled bays put nearer to St Peter's Arcade to get access into the city centre. If, and I'm not saying I'm for or against at this stage, St Peter's being closed, then we need to, I know the disabled bays have been moved further down now, but the work's going on while the work's going on in the town hall. But can we please make sure that we make arrangements for disabled drivers, and I would like to see the whole of St Peter's Road disabled friendly, so it's all disabled parking bays. So don't take those away, whatever you do, because it's going to be longer distance for people to walk as it is if you close St Peter's Arcade. So please bear that in mind. Disabled people need to be as near to the city centre as they can.
Yeah, thank you, Councillor Fox. Loud and clear, well understood, and I fully support your view on that. We'll make sure that definitely is the outcome, depending on what happens regarding the arcade itself. So thank you very much.
Councillor Bisbee, thank you for joining us.
Yeah, I do apologise. A couple of things I was dealing with in my other capacity, and I looked at the calendar wrong and thought it was tomorrow, so I do apologise. My question is about domestic abuse. In my other role, I am worried that in lockdown we get a lot more people who are locked in with their abusers, domestic violence, and when they do actually come out, they obviously get support. But I'm just wondering, if it's a family, would you put them in a refuge, or would you find them other accommodation that is more suitable for families?
Thank you, Councillor Bisbee. As you probably know, if you know anything about domestic abuse, it's very complicated, and it takes a lot of support for us to get somebody to actually break away from the situation that they're in. Therefore, we need to have a number of options that are available to them. A refuge is available, but often isn't the best option for somebody. To displace them away from their support, away from where their children, maybe at school, they may have local friends, it is often quite damaging. So we may provide temporary accommodation within the district. If we felt that was too dangerous, we may look at providing temporary accommodation outside of the district. We work really closely with domestic abuse services to make sure that we have the best options that actually fit the needs of the household that are presenting to us.
Yeah, thank you very much for that. It was just in my other role, it's an area where I'm asked quite a lot of questions about domestic abuse, and I just want to make sure that I have the right information from yourself. So thank you for giving me that.
Thank you very much.
Okay, committee, we've just got a couple more questions and then we'll move on. Councillor Yazin, please.
Thank you, Chair. Just a really quick question. Sarah, you mentioned the app where residents get alerts for properties that are becoming available so they can bid. Is that app well advertised, and are residents aware that they have that service available to them?
So I think they are aware that it's available to them. They generally log in via the Jigsaw app. It's an important point that you make. We're currently looking at the way in which we communicate with residents, and also in terms of the website as well, and that's something that we're looking at, and it's certainly one of the things we will be looking at putting on the website once we're able to update it, along with things frequently asked questions, and also in terms of the busiest times of our service, because what we tend to find is that we provide information in terms of something that's new, and then quite quickly that information is then given by word of mouth, through agencies, through our partnership working. So we just like to reinforce that, just to make sure that everybody does have that information. But yes, I think they do. Most people who log into the app are aware of this, aware of it, and have it on their phone or their tablet, because it's the most convenient way to use it.
That's fantastic. Thank you.
Councillor Harper, please.
Thank you, Chair. Through you. Sarah mentioned to Councillor Iqbal's question about the sort of housing first policy for rough sleepers. I just wanted to dig down a bit further on that. If somebody, for instance, had serious substance misuse problems, what sort of protection is there, i.e. in the suitability of where they're going to be housed? I mean, I'm thinking somebody with a serious drug dependence or problem, you know, if there was a flat next to a school, would that be highlighted and thought of before placement? Because if we went for housing first, we could cause a real problem. You know, the support system's there, but are we looking at the suitability of the property as well as, you know, what support services are around? Thank you.
Thanks, Councillor Harper. Yeah, and you raised an important point there. I probably wasn't clear enough in terms of housing first. Our housing first at the moment is placed within a supported housing setting. Okay, so there are staff there. Okay, and there is support on site. In terms of the housing first model that you're talking about, where people we look at flats throughout the city, we haven't done that at the moment. Okay, but what we have done is the really good work during lockdown to actually put those rough sleepers into accommodation and wrap the services around them, and in the vast majority of cases that has been an enormous success because we've had the buy-in of our partners of health, of substance misuse services, of mental health services, and it's been an enormous success.
Okay, Chair, thank you very much. Thanks for the answer. Like I say, I look forward to seeing how that develops as we go on. Thank you.
Okay, thank you for that. Okay, I'd like to note the recommendations in the report, which are for the committee to review the contents of the homeless review and endorse the development of a new homeless strategy, support the development of homelessness strategy from the information provided in the homeless review. If there's any objections, if you could raise your blue hand, please. Okay, thank you. Okay, right, I'd just like to say thank you to Sarah, Sean. I know that Mo's not available, obviously the whole team, and obviously including the Garden House, for the fantastic work they're doing. I'm sure the whole committee would like to, as they've done, a few members have, I'm sure the whole committee would like to congratulate them on the fantastic work they're doing. Okay, them officers may leave if they so wish now. Thank you. We move on to item agenda 7.
Do you want me to open that up, Chair?
Yes, Peterborough homeless allocation policy, pages 109 to 122. I'd like to, if Councillor Allen, if you'd like to begin.
Yeah, thank you. And we are lucky to have the two Sarahs with us tonight. This one, this homes allocation policy is very well put together. It really follows on nicely from the previous two agenda items, highlighting the housing allocation policy changes and the element of providing warm, safe, secure housing. Sarah's put together a report, and I'll hand over to Sarah for any questions.
Yeah, thank you, Councillor Allen. You are a bit echoey.
Echo.
Thank you, Councillor. Sarah, are you muted?
Oh, hi, sorry, I was waiting for questions. I can give an introduction if you like.
Yeah, sorry, Sarah. Did you want to go straight to questions, or did you want to?
Yeah, I'm happy to go straight to questions.
Okay, fine. Thank you. Okay, Councillor Howard then.
Thank you, Chair. I was just looking at the proposed bans and categories, and I was just looking at, with particular interest, band 2, where we've at the moment proposing that those who are threatened with homelessness and have agreed to work with us to prevent their homelessness. I'm just interested to know why they're in band 2 rather than band 1, especially based on our previous report. Is there sort of, there's obviously a method behind that, but what is the method, please?
Yeah, so actually that's no change to the current banding system, and you'll see that I've done the current band and the proposed band. So at the moment, those households who are accepted as threatened with homelessness are currently awarded band 2. The difference to our very initial proposals that are documented here is that once those applicants who go through to main duty accepted, they would then go into band 3. Now, the reason behind that is because exactly what Sarah's talking about in her homelessness strategy is this prevention model. We really want to use this opportunity for the allocations policy to reflect a preventative service. And so what we want to do is we want to encourage people when they're homeless or threatened with homelessness to work with us. And that's why we're keeping that priority as band 2 when people are threatened with homelessness, to enable them to work with us, because we are quite confident that if people work with us, we will be able to support them to obtain either alternative accommodation or to remain in their current accommodation if it's practical to do so. So that's the reason why.
Thank you very much. That makes sense. Thank you for that.
Councillor John Fox, please.
Yeah, thank you, Chair. I'd like to say it's so pleasing to see a whole large paragraph in this regarding our forces personnel. I think, Adrian, you'll agree we've come a long, long way in a very short time. And it's thanks to people like Sean who's pushed this and the housing people. And it's great to see that we've got a forward-thinking, positive administration that's looking into our forces personnel. And I'm personally, as an ex-veteran, really chuffed that we've come this far. And I don't want to see anybody homeless, but this has really been important and it's paid off. And thank you all again for your hard work, because it doesn't just happen. It's because officers get behind these things and push it, and the administration as well. And you can say what you want, but you've got to give them credit when credit's due. They have pushed this as well. So it's fantastic. And to see that big paragraph all about it, that never happened. It's happening now. So well done to all of you.
Thank you, Councillor Fox. And while I might be going for the military cut, I can't take the credit for that one. That was Sarah.
So just to elaborate on that, Councillor Fox, obviously these are very, very initial proposals, and we are going to be going hopefully into consultation next Monday, where we'll obviously be able to do some more digging about best practice in relation to priority for forces personnel. We just thought, having looked at 5 or 6 allocations policies across England, we thought that actually that sat with quite good practice. So certainly it's something that we'll obviously continue to look at and consult on with members of the public and our partners, how we can develop that offer.
Yeah, it's hard enough when you come out of the forces readjusting, but when you've got problems like finding a job, finding a house, and then schools, and if you've got 3 or 4 children getting different schools, it's hard enough. But this is now really going in the right direction and giving our forces support they definitely deserve. So thank you very much, all of you, whoever it is that's been digging deep in background. Fantastic, and thank you.
Councillor Ellis, please.
Thank you, Chair. Okay. I do agree that to simplify the allocation system and the banding is a good idea. Obviously, my first, not call me a skeptic, but hopefully I am totally wrong, that the allocations policy isn't being changed to reduce the housing register. I'm sure that isn't correct, but just assurance on that, perhaps. Some specific questions on it. It says that I welcome the different bandings for the amounts of money given the different types of, on the threshold on 4 points. Let me get it right, page 4 points. I think it's 4.10. Yeah, 4.10, the income threshold, given the cost of renting 1 bedroom, 2 bedroom, and 3 bedroom. On 4.5, the bits about employment. Now there will be loads of people who can't work for long-term health conditions. I hope that isn't, meaning that they'll be disadvantaged in any way. And looking at 4.12, just a clarification there when you're looking at households with children. I understand the point about young children, but what about adult children with disabilities, special needs? I hope that doesn't preclude them, because sometimes they rely upon the care of their siblings or whoever in order to carry on. So just some answers on those to start off with, or well, not to start off with.
You was a bit echoey there, Councillor Ellis.
Right, okay.
There's about 3 questions there, I believe.
Sorry, Chairman. Just while Councillor Ellis was speaking, I had to mute Sarah just to avoid feedback. So, Sarah, if you could just unmute yourself now to respond. Thank you.
Hi, sorry, I'll try and answer all your questions. So you're exactly right. This is an exercise to reduce the housing register. What this is an exercise to ensure that we are able to house those people and give priority to those people who are most in need. We have to recognise that there is huge demand for social housing and a huge shortage of social housing. What our allocations policy must do is it has to recognise that, and we have to ensure that those people with the highest need are supported to be rehoused, given the right priority. In relation to income thresholds, yeah, thank you for that. I completely agree. We need to be looking maybe at a different method. Our initial proposals, as outlined in the paper, are to separate that by bedroom need. Certainly, the thresholds we're going to be consulting. We're going to be hearing other people's consultation on those thresholds. Completely. We are no way there. What we're suggesting is we need the allocation and support those people who are working and who are in relation up to employment, are just to ensure that we acknowledge the fact that economic growth is a sort of key priority for Peterborough, and we want to look at ways that potentially the allocations policy can encourage people to work and to sort of raise our levels of aspiration for people to gain employment. Thank you as well in relation to your last question about children with disabilities. Certainly, that point there is not in relation to households with children with disabilities. All that point means is that a general needs house who have got adult children would be able to bid on flats and maisonettes. Whereas what we'd like to ensure is that families with young children are able to be given that priority for houses, so that they've got a garden, more likely to have a garden for their young children. In relation to families with disabilities, there's absolutely no way we're looking at separating them or not allowing those children to be with their parents, whether they're young children, adult children. We are very keen to ensure that people with disabilities, that we are ensuring that their needs are recognised, and we are looking at how the allocations policy can ensure best use of housing stock, so that properties which are adapted are going to those who need those options.
If I could just add as well, Chair, on the point around income thresholds, Councillor Ellis, it's important to point out that there's already something in the current allocations policy around income thresholds. However, in truth, it's a bit of a blunt instrument. It applies right across the bedroom needs. What we're looking at and what we're consulting on is a much more technical way of assessing affordability and determining how much somebody would need to be earning in order to be able to rent accommodation privately rather than relying on social housing. And then lastly, in relation to your last question around adults with disabilities and being considered for houses with gardens, as with any of the the cases that we deal with. Obviously, we can't fetter our discretion, and while we have a policy, there is always cases that will fall outside of that policy, and we have the ability in our management structures to be able to consider those cases on their merits, and we can award the relevant priorities that they require in order to ensure that their needs are going to be met.
Thank you for that. Okay, I don't know what's happening with the sound this evening, but just my apologies for that. Okay, Councillor Bisbee, please.
Thank you. My question's on 4.11, and it's to do with antisocial behaviour. You'll be seeking views about antisocial behaviour, how long applications should be suspended for, and we propose time spent in temporary accommodation without issue should be included in consideration for any suspension to be lifted. I'm just wondering, what are the time limits at the moment, and are you intending to increase them? Because antisocial behaviour is something that, if you have somebody who is antisocial, who's doing antisocial behaviour within your area, it has a significant impact on the community. So I'd want to make sure that the antisocial behaviour is gone and it's not just a very short space of time. So what are your views on the time that you think should be relevant?
Thank you for your question. I completely take your points on board. So that's exactly what we want to consult on. We want to understand what people believe is a reasonable time. At the moment, anybody who has been committed antisocial behaviour, they are unable to join the housing register until such time that a panel meets and agrees that they are ready to be shortlisted for accommodation. So at the moment, there's no specific timescales in the allocations policy. It is just met by a group of partners. So that will be Peterborough City Council and representatives from the Peterborough Homes Partnership. And we get together and we discuss each individual case. And we're not suggesting that that process shouldn't happen. What we want to ensure is that somebody who has changed, people who have made a mistake and they have moved on and they are in a much better position, they are managing to maintain a tenancy without issue, we don't want them to be penalised. We want to ensure that our allocations policy is inclusive. However, I take your points on board about the detrimental effect it can have and social behaviour can have on people's lives who are having to experience it. So we just want to make sure that firstly, those people are able to who can show us that they have changed, that they have changed their ways, that there is a clear way for them to be able to rejoin the housing register. But we're looking at sort of time thresholds. We're looking at whether the panel still is an effective panel. That's exactly what we want to consult on.
Okay, thank you for that.
Can I come back with a...
You may, Councillor Bisbee.
Yeah, thank you. My second question is, on the panel, how do you make sure that you are aware of all the behaviour that they've had? I mean, who are you consulting with to make sure that they have been living a life without any antisocial behaviour? Because I know the information can get lost somewhere in some places. So I'm just wondering where that information is coming from. Is it police? Is it social workers? Is it complaints from other people? Where is it, please?
That's a really good question. So we consult with the Prevention Enforcement Service, with the police to find out what's going on, with the landlord to understand whether there's any issues. And often if it's a social landlord, they're very aware of issues. So we consult with a wide range of partners to understand how that person is currently maintaining their tenancy and what issues there are going on.
Is that okay, Councillor Bisbee?
Yes, thank you very much for that.
Okay, if there are no further questions, I would like to note the recommendations in the report, which are for the committee to review the contents of the report and endorse the developments of the new housing allocations policy and support the commencement of the consultation period by the Cabinet. If you object to this, can you please raise your virtual blue hand? Okay, no one seems to be objecting. Okay, thank you, officers, for presenting it. Obviously, thanks again for the great work. Really, really pleased, and the whole committee, I'm sure, would like to thank you. Okay. Okay, bit of feedback there. Okay, moving on to agenda item 8, portfolio holder progress report, housing, culture and recreation, pages 123 to 130. I welcome Councillor Steve Allen, Cabinet Member of Housing and Culture and Recreation, who will present this report alongside the following officers: Kitchen Eastman, Managing Director of Peterborough Limited, Pat Carrington, Principal, City College Peterborough, Jamie Fenton, Culture and Leisure Development Manager, and of course Adrian Chapman, Service Director, Communities and Partnerships. Councillor Allen.
Thank you, Chair. It looks as I've got the cavalry with me tonight. Thanks, officers, for your support. And I hope that my microphone is now not echoing.
Much better. Thank you.
Thank you. Okay. Thanks for the opportunity to present my report. You'll notice that it's a very diverse portfolio, straddling 2 distinct and very different areas: housing and homelessness, and culture and recreation. Both areas, of course, are not without major challenges with the onset of the COVID pandemic, and in respect of the culture part of the portfolio, the demise of Vivacity. The report covers off how these circumstances impacted and how we have mitigated the pressures, together with our plans and proposals going forward. The report stands, and I would just pass it over now to members for questions, should they wish.
Okay, Councillor John Fox, please.
Thank you, Chair. You wouldn't expect me to go past 4.4.12 and 128. Scroll past that. I'll keep it very short. I'd like to thank you, Councillor Allen, Adrian Chapman and Jamie, for restoking the fire. I'll leave it at that, because if it happens, which I'm, I'm not still 100%, I'm 99 point. But, when I see the cranes there, I'll be 100%, positive, because, how things happen. But it will be a great, great asset for Warrington. And, I thank you for stoking the fire. That's all I'll say.
Thank you, Councillor Fox. And I promise that I'm certainly behind that. And I have spoken to this committee before about how I believe we should have more water in Peterborough, so that the facilities are provided to each of the communities best we can.
Hear, hear.
Yeah, so Julie Howe, please.
Thank you, Chair, and thank you, Councillor Allen, for your report. I'm not sure if this is a question that you'll be able to answer right now, and that's fine. It came to me during some of the early reports, actually, when the subject of hoarding was mentioned, and I just wondered, in the context of housing, of homelessness, of mental health, of Aragon now being under Peterborough Limited as well, under lockdown, has hoarding worsened? And in the context of our ability to provide means to get rid of bulky waste and everything, and also certainly in my area where I have a bit of a problem with rats because of people hoarding in their back gardens because they can't get rid of stuff. I just wondered if you had any impression of the picture with hoarding and housing and mental health, and how people are getting on with that. Thank you.
I don't have any personal overview on that, other than as a ward councillor, the fact that I am certainly contacted from time to time about pest control, which, as you know, the City Council doesn't provide, and it's down to householders to manage their own properties. But I don't know whether Kitchen Eastman has any input on the elements that you're talking about, how we're getting rid of what they hoard.
Thank you, Councillor Allen. In terms of through lockdown, looking at the Aragon side of things and waste collection, we saw waste rise by approximately 30% all the way through lockdown. So our binmen were working really hard, but they were having to collect an awful lot more waste. Now, some of that was because it was diverted. So people are working from home. So obviously that's not going through the commercial area, people not eating out. So again, more going through. What was quite disappointing is that we didn't see a rise, such a rise in the recycling, or indeed the food waste collections hardly went up at all. So most of it ended up being residual. Now, we didn't have the bulky collections either for a while, due to just trying to get the right number of staff in place because we had people shielding as well. They have been back up and running. We had to just pause them briefly for about a week because of people having to isolate due to COVID, but they're back up and running and they can be booked quite easily. And with the household waste site open again, those options are there. I don't have any information about how it might link into specific people hoarding in relation to their own areas, but waste has been interesting through COVID, I would say.
Sure, thank you.
Adrian, would you like to come in?
Yeah, thank you, Chair, and thanks, Councillor Howell. Just to reassure the committee, what we'll do is ask the relevant officers to provide us with a briefing note, because I think Councillor Howell's point is a very important one around the impact that particularly the pandemic has had on people generally, but particularly vulnerable people, and hoarding is associated with, you know, some very complex circumstances. So I think it's a really interesting point. I couldn't answer the question this evening, but I will make sure that we get a response, and also if we have seen an increase, what proposals we are putting in place to deal with it. You give for your forbearance, I'll get that out to you as quickly as I can.
That's wonderful, thank you.
Councillor Howard, please.
Thank you, Chair. Yeah, thank you. I just want to say thank you for a brilliant report, and just to commend everyone who's worked behind the scenes on the transfer of Vivacity back to council services. Now, I know for a lot of us, we probably can't even quantify the work that went on behind the scenes doing it, but just to say thank you for the effort that went into it, because with 2 lockdowns and a pandemic, and the shock of the announcement from Vivacity in the first place, it cannot have been an easy task. So just to commend everyone who's been involved in that on behalf of all of us, really. Thank you.
Councillor Howard, that's very good of you to say that, and I'm sure the officers listening will appreciate your comments. It was a very complex handover, and I think it's been handled very well.
Can't you see how much greyer Adrian is?
Grey, bags under the eyes.
Councillor Ellis, please.
Thank you, Chair. Thank you, Councillor Allen. I know it's been a hard time with COVID-19 affecting a lot of the services on top of Vivacity. First of all, what is there any update to report about how this lockdown too is affecting services? And obviously we don't know yet if we are, but hopefully we'll be out of it beginning of December, but there's no guarantee on that. Also, an update on the regional city centre swimming pool. I understand that there are plans for either relocation or a new swimming pool provision in the city centre. And a little bit of more information under 4.4.13, the grants for grassroots football provision.
I'll take them in reverse order, Councillor Ellis. What was your last question?
About the grants for grassroots football provision.
Grassroots
4.413. Let me just give you the
4 point what? Sorry.
Yeah, the Football Foundation local football facility plans. The grants available for grassroots football.
I can't hear you very well. The 4.13. 4.13. Okay.
Page 129, Councillor Allen. 4.4.13.
What at the end?
13. Okay.
Jamie,
we'll find it and then I can probably respond. No,
Jamie might be able to help you with this one.
There we go. Following the Football Foundation local football facility plans in September. I think that that's self-explanatory, isn't it? It says that it's slowed down, and I think that with the current COVID pressures, we can't give you a further answer on that. Whether one of the officers wants to come in there, but I think that is self-explanatory. Now, the library will be opening 1 floor. You're talking about things that are affected adversely by the current lockdown. Central Library will be opening 1 floor only. The number of elements are being affected by the current lockdown. We're expecting to open the museum, hopefully, for the relaunch day on the day after the lockdown finishes, we hope. invitations have gone out to many people. So things are going to be moving forward step by step as the lockdown allows us to escape from the current restrictions. If anybody can be more specific on the questions that Councillor Ellis has asked, then I open it to officers.
And the swimming pools?
Swimming pool. Well, we are scoping the opportunity of moving the swimming pool to a new location in the city centre. As you know, it's going out to consultation at the moment, and I believe there's a meeting lined up in the fairly near future to look at how those proposals are being progressed.
Okay, and just a little bit more information, perhaps Adrian, about the grants, what the grants are available for the local grassroots teams, football teams.
Thank you, Chairman. If I might come in here, I'd like just suggest that Jamie provides a little more detail to Councillor Allen's very comprehensive answer. Jamie will have up-to-date information on that point at 4413. Then I wonder if we might just invite Pat and Kitron very briefly to update on the point that Councillor Allen has summarised around the impact of lockdown on services and what our ambitious plans are for reopening.
Yes, please. Pat, would you like to go first?
Thank you, Chair. Yes, just firstly to give you an update on the libraries, because this is an area that we are able to support in during this current lockdown. Central Library, as Councillor Allen has said, we're opened one floor so we can continue the support that we give to the council in terms of the meetings there. But we've also been allowed now to open up Central Library part-time to give access to the computers for people that are digitally excluded currently, so that they can access job applications and also council services, so that we don't disadvantage them during this lockdown period. And we've also been allowed to open up a select and collect service at Central Library so that people can actually phone up, book their books, and then we give a timed collection so that they can safely collect their library selection and take them home with them. So the library is being able to offer some limited support. As Councillor Allen quite rightly said, we are planning to reopen the museum, COVID allowing and health and safety allowing immediately after this current lockdown. The plans were in place, so we're able to pick those up and continue with them. And in terms of Flag Fen, again, COVID allowing, we are looking to open up Flag Fen during the winter, which hasn't been done before, but we believe that that outdoor space and the ability for local people to access the walks there would aid in terms of COVID recovery and giving access to green space and exercise. And then finally, the Key Theatre, again, will be guided by the government's guidance on this, but we are ready to reopen a limited service because we have challenges with shows not being able to run because the touring companies have cancelled them because they can't rehearse. But we will look as soon as we're able to put a service on for local people so that they can access all of those facilities.
Thank you for that. Okay, Kitron, over to you.
Thank you, Chair. Well, we had a number of sites obviously open and running before the second lockdown, which did knock us a little bit for six. So Regional Pool and the athletic track were open, as with Battersea Premier Fitness, Hampton Leisure Centre, and we were literally just about to start the swim academy again, which we had put a lot of work and effort into. However, we are making the best of the lockdown that we possibly can. So all those services should be ready to open and get running as soon as the lockdown comes out, including the swim academy. We want to get people back into that as soon as possible. We've been utilising the time as well to do additional maintenance in all the sites, go through, do deep clean. So we are especially ready for opening. In addition, what we've tried to do more of this time is some of the healthy and active online opportunities, and we've decided to make those available for everybody. So either through the Vivacity website, or actually if you follow us at Vivacity Healthy and Active on Facebook, you can now get special sessions which are run and live streamed, or indeed you can access sessions which are pre-recorded by our staff, just to try and keep people actively engaged through this lockdown, because we know some people are suffering, and we want them taking part. But we've made them available for all of Peterborough to be able to use those. And actually we've seen just in the last few days 180 extra follows on the Facebook page just from launching them. So we are really proud of the staff for doing that. So we will reopen all of those services up as soon as we can, and add in the swim academy. We also are in the process of fixing one of the 3G pitches which was damaged, and we hope to open that up in and around the Bushfields area come December. And we're also going to be looking at the additional outdoor activities we can get going. We are still working with the schools on the dual access sites, because there's a lot of pressure in the schools for the space, and we'll continue to work with them, and at the right time we'll open up those facilities, but we'll be in discussion with Adrian about them.
Thank you, Kitchen. Okay, I'd like to note the recommendations in the report, which is for the committee to consider and scrutinise this report and endorse the approach being taken under the portfolio of Cabinet member. If anybody objects, can you raise your blue virtual hand, please? Okay, nobody's objecting. Okay, thank you. Okay, thank you, Councillor Allen. Keep up the good work. Also, obviously, I'd like to thank Kitchener, Pat, Jamie and Adrian for the obviously sterling work they're doing. Keep up the good work. Thank you from all the committee again. Thank you.
Thank you,
okay.
Chair. Good night, members.
If you'd like to, yeah, you can leave the meeting if you so wish. Okay, agenda item 9. Proposal for the task and finish group to examine issues with car cruising in Peterborough. I think there's 4. I think we're going to. David, did you want to just introduce? I think we're going to do all 4 together. Is that right, David?
So, Chair, the task and finish group for car cruising will be discussed on its own, and Adrian, I think, will introduce that, and then the other 2 on the qualities will be discussed together.
Okay, thank you. Okay, Adrian, would you like to present this, please?
Thank you. Yeah, thank you, Chair, very much so. You've had a busy evening, so I'll keep this very brief. So we have 3 reports, all following the last full council meeting, where motions were passed that asked this committee to establish task and finish groups. This first report, starting on page 131, relates to the challenging issue of car cruising and associated ASB. So the motion, which was presented by Councillor Coles and agreed at full council, is described in detail at 4.1 and 4.2, and set out at Appendix 1 on page 135 is the draft terms of reference for that task and finish group, with some recommended advisors, including the constabulary, which was a specific request in the motion. I believe that group secretaries have already been contacted or in the process of being contacted to identify representatives from the groups to sit on this. That may not have happened just yet, but is in the process of happening. So we're looking this evening for agreement to form the group and to the terms of reference, please.
Okay, any questions? No hands raised at the moment. Okay, I would like to note the recommendations in the report, which offer the committee to agree the formation of the time-limited cross-party scrutiny task and finish group, agree the terms of reference for proposed task and finish group, agree that outcomes of the task and finish group should be presented back to this committee at a relevant meeting, make any initial nominations from the scrutiny committee members to join the task and finish group. Okay.
Sorry, yeah,
Councillor Howell.
Apologies, Chair. I was a split second too slow raising my little blue hand there.
Okay, no
I was
problem.
just going to say that I think the terms of reference will need quite a bit of work. It's a very complex issue, so I was just going to make that point.
Okay, thank you. Okay, so we'll move on. Okay, thank you. We'll move on to agenda item 10, and we're going to put that together with 11, David. That's right, isn't it?
Yeah, it'll be over to Adrian again to introduce.
Oh, okay. Would you like to?
Thank
would you like to move on these, Adrian?
Thank you. Sorry, me again. Yeah. So
sorry.
So these reports, items 10 and 11, cover very similar themes, although different in the detail, but both are associated in some way to the broad theme of equality. Again, both motions were passed at full council, one from Councillor Wiggin and the second from Councillor Walsh. The same format in this report as the previous report. We've set out the detail of the motion as amended and passed at full council, along with draft terms of reference. And I very much agree with Councillor Howell's point. The terms of reference, I think, for these two task and finish groups and the previous one will inevitably require some input from the first meeting of the task and finish group, which I think I'd certainly welcome. So the terms of reference set out in these reports are really the bare bones of the work that's required. The reason we're asking you to consider both reports at the same time is because of the similarities in some of the themes, is to request that committee considers merging the two themes into a single task and finish group, partly from an efficiency point of view, but actually moreover because I'm fairly certain that a lot of the themes, a lot of the context, a lot of the background work will be similar, if not identical, in both groups. So that was our thinking. If that is agreed, we'll clearly need to present to the first meeting of the task and finish group proper a revised, merged terms of reference, which we'll obviously work on in the background. Thank you, Chair. I think that's all I need to say.
Okay, if someone would propose that recommendation. Councillor Howe.
Yeah, I would be very happy to propose that recommendation. I think that's absolutely the right thing to do.
Yeah, Councillor Iqbal, are you seconding?
Yeah, I'm happy to second that, yeah.
Okay, thank you. We'll go to the vote then, David, shall we?
It might just be worth seeing if there are any members who wish to object first. Before.
Any objections to that, please? Please raise your blue virtual hand. Councillor Iqbal, you're not objecting, are you? Your hands up, but you are muted. Thank you.
I'm seconding.
Thank you. That's what I thought. Yeah. Okay. Okay. Thank you. That's unanimous then, David. By the looks of it. Yeah. Thank you.
Yeah, thank you.
Thank you, members.
Okay. I think we'll move on to agenda item 12.
Okay, thank you, Chairman. Agenda item 12 is the recommendations monitoring report. Gives members the usual opportunity to review responses to recommendations made at previous meetings and decide if any further action is required. On that, I've marked several items which have received responses as completed with an asterisk, just to give any members the opportunity to object if you didn't want to mark those as completed.
Okay, anybody got any, Councillor Ellis.
Thank you. Page 153, selective licensing review. We're awaiting outcome from government and it's likely to come before the end of the year. Is there any updates on that?
I will request an update, Councillor Ellis, and get that circulated to the whole committee.
Okay, thank you.
Yeah, because I think it would be nice if it went broadened a bit, I think, wouldn't it, Councillor Ellis? A bit more broader. Yeah, absolutely. Okay. Anything more to say on that, David? No?
No, that's it. Thank you, Chair.
Okay. Agenda item 13. Over to you, David. Forward plan of executive decisions.
Thank you, Chairman. The standing items gives members the opportunity to request any additional information on forward plan items relevant to this committee. And the version of the forward plan attached to the agenda is still the current version. Thank you.
Anybody? Okay, we'll move on to agenda item 14, work programme, David.
Thank you, Chairman. This just gives members a formal opportunity to suggest any changes to the work programme, but this will of course be discussed again at the group reps meeting next week.
Okay, thank you. Okay, committee to note the date of the next meeting on 19th of January 2021. Can we believe that? Okay, I'd like to thank everybody for attending tonight. It's been quite a difficult meeting with the sound and everything, so I appreciate everybody's input. It's really appreciated. Have a good evening. Thank